guys, it's me, Dr. Ree, and in this video we're going to be looking at the appendicular skeleton. Now, the appendicular skeleton is comprised of 126 bones. Although the upper and lower limbs differ in their functions and mobility, they have the same fundamental plan. Each limb is made up of 3 major segments. So here in the upper we have our shoulder girdle, then our major segments. In this instance, we have our humerus of the upper extremity, the radius and ulna, and then the carpals, metacarpals, and phalanges. In the lower extremity, we have our attaching site of the pelvis, which is made up of 3 bones, the ischium, the ilium, and the pubis. Then we have our long femur, our tibia and fibula, and our foot, which is comprised of the tarsals, metatarsals, and phalanges. So let's start with the upper extremity. The first bone we're going to be looking at is the scapula. The scapula is found between, we have an anterior view, a posterior view, and a lateral view. On the anterior view, we can see right here at the top is the acromion process, coracoid process. We have a couple of different angles of the scapula. So this one up here is the superior angle. And down here at the very bottom is our inferior angle based on their location. We call this side the medial border, and this one is the lateral border. These borders are going to be important when we start looking at the muscles and where the muscles attach. And where they attach is going to help with their function and what they do to the shoulder blade during motion. Now this purple area right here, this is where the glenoid fascia is. The glenoid fascia is where we have the humerus connect to this region. It's what creates the GH joint. And superior to that, we have the supraglenoid tubercle, which will be an important muscle attachment site. Supraglenoid meaning above the glenoid fascia, tubercle as it's a place of attachment. If you remember back into the osteology, the intro to osteology thing, we talked that tubercles, when they're being formed, are called apophyses. So the tubercle used to be an apophyse right there. Right here in the middle is our subscapular fossa. Another big area where we have muscle attachment. Now let's look at the posterior view. On the posterior view, this area right here, this kind of long area right here, this is called the spine of the scapula. Superior to the spine of the scapula is the supraspinous fossa. And inferior to the spine of the scapula is the infraspinous fossa. So they're named based on their location. Up here, this is just the back side of that acromion that we saw before. And right down here is what's known as the infraglenoid tubercle, another important attachment site. On the lateral view, you just get a good view of kind of what it looks like where that glenoid fossa is. So to reiterate, the acromion is going to be where the clavicle and the scapula articulate. The coracoid process is the attachment site for the pec minor, coracobrachialis, and the short head of the biceps brachii. The supraglenoid tubercle is the attachment site for the long head of the biceps brachii. The infraglenoid tubercle, I'm going to abbreviate tube, is the attachment site for the long head of the triceps brachii. And the spine of the scapula is found at the level of the thoracic vertebrae T3. So those are the things you need to know about the scapula. Now let's look at the clavicle, the second part of that shoulder girdle. The clavicle articulates with the sternum, which is part of our thoracic cage that we talked about in the axial skeleton. So the clavicle is the location, or is the bone that connects the appendages to the axial skeleton. So the clavicle articulates with the sternum and the first costal cartilage medially, so in the middle, and the acromion process laterally, the acromion process of the scapula. So this image is showing an anterior view. So if you were looking straight at a skeleton, this is what or a person, this is what you would see. This top part, I just have this saying that this is superior. So this is the superior structures, the top structures, this is the bottom structures of the clavicle. So as we're looking at this, right here at the very end is the acromioclavicular end. The name tells you what joint it's going to be. It's going to be the connection point of the acromion and the clavicle. That would be on the lateral aspect, or the distal pole, right? That's going to be more lateral because that's where it's attaching. As we come medially, so if we go on the other side, we call this the sternoclavicular end, or the medial part. Because this is where it attaches to the sternum. In green here, this is the attachment site for the trapezius. In red, we see the attachment site for the deltoid muscle. In blue, we see the attachment site for the SCM, the sternocleidomastoid muscle. And in purple, we see the attachment site of pec major. So for this being such a small bone, it holds some of the biggest muscles. It's the attachment point for some of the biggest muscles in the shoulder girdle and the upper extremity and back. Now let's look at it from behind. So if you're going to behind, so in order to do that, you would if you took your hand and you kind of grabbed onto your clavicle, when you push your fingers on either side, now you're going into that posterior aspect. This part, which looks superior, is actually the inferior because I kind of just took it and flipped it over. So this is the inferior part, this is the superior part, just so you don't get confused. So the purple here is still going to be the attachment site of pec major. Okay, the red is still going to be the attachment site of the deltoid. Now these yellow parts are a couple of different important areas that I want you to be able to identify. The first one is the trapezoid line. The next one is the conoid tubercle. And then this other yellow spot is where the costoclavicular ligament attaches. Green is where we have the subclavian groove, where the subclavius muscle attaches. And where that orange is where the sternohyoid attaches. Now let's go down the upper extremity, starting with the humerus. There's a bunch of different kind of aspects that I want you to know when it comes to the humerus. Let's first look at this anterior view. Up here in the top, we see the greater tuberosity. This is the attachment site for the supraspinatus, infraspinatus, and teres minor, all of which are part of our sits muscles, or our rotator cuff muscles. We'll talk more about that when we get into the muscular system. Right here in yellow, you can see the lesser tuberosity, which is the attachment site for the subscapularis, the last of the rotator cuff muscles. And in the middle of those, between the greater tuberosity and the lesser tuberosity, you have the bicipital groove. And the bicipital groove is the attachment site for the latissimus dorsi, teres major, and pectoralis major. So it goes greater tube, bicipital groove, lesser tube. As we come down, where we see this purple line right there, that is our deltoid tuberosity. That is where the deltoid muscle connects. So we see the deltoid connects in the clavicle. It also comes and it connects onto the humerus at the deltoid tuberosity. If we go inferior, again in the anterior view, we have a few different regions. So in pink, we see the coronoid fossa. A fossa is kind of like a little bowl-like structure. Then on the other side of the coronoid fossa, on the radial aspect, we're going to see the radial fossa. Inferior to that, we're going to see the capitulum. And then right next to the capitulum is going to be the trochlea. Trochlea, C-H-E-A. Spelling is hard. So that's what we're looking at when we're looking at the anterior view. Now, I want you to look at this picture right above here so you can see how this articulates with the radius and ulna below. So you can see here that the radius is connected to the capitulum, right? So if you have your hands in anatomical position, the ulna, starting with a U, is towards you, right? It's more medial. The radius is going to be away from you. So ulna, starting with U, is closest to you as a person. Okay, so that's going to be the medial aspect. Radius is lateral aspect. So when we're looking at this, this is the lateral aspect. This is the medial aspect. Okay, so right here we see the radius in blue, and where the trochlea is attaching to the ulna. And we'll talk more about that in a second. Now let's look from a posterior aspect. So looking from the back, front. So we have a lot of the same kind of structures. Up here is where the head of the humerus is going to be. Below that, we see the neck. Specifically, it's called the surgical neck. There's an R in surgical. Surgical neck. You can see why I am not a spelling professor. So we have the surgical neck. It's named this because this is a really common area where, you guessed it, we have surgery. Okay, so it's a common area where we're going to have fracture, if we're going to have fracture in the humerus. Below that is the spiral groove. The spiral groove is an area that the radial nerve will travel upon. The radial nerve is going to supply all of the musculature of the posterior aspect of the arm. And then down here in purple, that's the olecranon fossa. The olecranon fossa is going to be the location that the ulna attaches or stops movement when we start to go into extension with our elbows. So the ulna is here, and in this picture, this is the radius. So the radius attaches to the capitulum. The ulna attaches to the trochlea and the olecranon fossa. So all of these words down here, I forgot that I had words down here. All these words are just reiterating what I just said. So if you want to take a second, read them, take a picture of them, write them down, go for it. I'll just fill in that the capitulum articulates with the radius. The trochlea articulates with the trochlear notch of the ulna. That the coronoid fossa houses the coronoid process of the ulna when the arm is flexed. The surgical neck is the most common area for fracture in the humerus. And that the olecranon fossa houses the olecranon process of the ulna again. All right. Let's move on to the radius and ulna then. So the radius, again, like I said, is lateral. The ulna is medial. Ulna with a U is next to U. Now the radial notch of the ulna articulates with the radial head. Whoa, that's a lot of words. Okay, so the radial notch on the ulna articulates with the radial head. This is going to be the proximal radial ulnar joint. So proximal being closer to the shoulder, so closer to the axilla. So this is going to be the top one. So let's label where those are located here. This right here is the radial notch right? And this bone right here that we're seeing that I have drawn right here, this is the ulna. Okay, so the radial notch of the ulna articulates with the radius, with the radial head. This is the radial head right here. The distal radial ulnar joint is where the ulnar notch, which is right here, articulates with the end of the ulna. Okay, so don't get confused. A notch is on the opposite bone of what it's talking about. So the ulnar notch is on the radius, and the radial notch is on the ulna. Sometimes that can be confusing. When you see a notch, typically in anatomy, it's named by what articulates with it, not by what bone it is on. And that can be confusing for a lot of students. There's a few other structures that I just want you to be aware of when we look at the radius and ulna. So starting on the radius, right here below the radial head, we have the radial tuberosity. And if we look down here at the bottom, this little green area is called the Lister's tubercle. And in class, I'll show you how to palpate for that and be able to feel that on someone's arm. It's an important site for some of the musculature that goes into the hands. And then right here on the end is the radial styloid, which you can feel right on your wrist. When you feel on either end, those like pokey little spots that you kind of feel. On the radial aspect is the radial styloid, and on the other aspect is the ulnar styloid. The other things to mention while we're looking at the ulna is kind of the top of the ulna. At the very, very tippy top, we have the trochlear notch. Below that, we have the olecranon process that is going to go into the olecranon fossa of the humerus. And then we have the coronoid process that is going to articulate with that coronoid fossa that we saw on the humerus. Our last upper extremity region to talk about is the hand, which is made up of the carpals, the metacarpals, and the phalanges. So I kind of color-coded these for you. In pink, we're looking at the phalanges. So in all of the fingers except for the thumb, we see that we have 3 phalanges. We have a proximal, middle, and distal. So we have this is a dip, a pip, and an MCP. That's the name of the joints. So this is the distal interphalangeal joint is right here. This is the proximal interphalangeal joint right there. And this is the metacarpal phalangeal joint right there. The metacarpals are in blue. There are 5 metacarpals. And they are read from the thumb, right? They're going to be read from here. So this is 1, 2, 3, 4, and 5. And then we have our carpals. And there are 8 carpal bones. And you are responsible for knowing the 2 rows of the carpals and putting them in order, from lateral to medial or medial to lateral, either direction. Now I have an acronym that will help you answer this, and that acronym is Some Lovers Try Positions That They Can't Handle. So let's start with the proximal row. The proximal row starts with the scaphoid. That's our sum. The scaphoid is the most common carpal bone to fracture, and it's the floor of what's known as the anatomical snuff box. So your scaphoid is kind of the bottom right below your thumb. You can see that right here. Next is the lunate. Lunate stands for lovers, and this is the most common carpal bone to dislocate. Now the next few kind of get confusing because we have 3 different T's. So scaphoid, lunate, triquetrum. Then pisiform. So that is the proximal row. Proximal row meaning the closest to the radius and ulna. Scaphoid, lunate, triquetrum, pisiform. Some lovers try positions. The distal row, so the closest to the metacarpals, starting from the lateral aspect, is the trapezium. You can try to remember that the trapezium is on the thumb. Okay, trapezium on the thumb. That will remind you that trapezium is the one that is closest to the thumb. Next to trapezium is the trapezoid. Then the capitate. And finally, the hamate. So the distal row is that they can't handle. A lot of students get really confused with the carpals, but if you remember your little saying and you practice writing them out and even using your hand and trying to feel where they are on your hand, that will help you a lot when it comes to questions and exams. Now let's move on to the lower extremity, starting with the pelvis. So there is a lot to learn about the pelvis, and I'm not going to get into every little bit of the pelvis. We are going to focus on some of the more broad aspects. The pelvis's fancy name is the os coxae. It is the fusion of 3 different bones, the ilium, the ischium, and the pubis. When you're a child, they're not fused. So if we're looking right here just to show in pink, this would be where we have our ilium. In green, this would be our ischium. And in yellow right here, that would be our pubis. This right here is our sacrum, and we remember that our sacrum is part of our vertebral column. It is not technically part of our actual hip. So there's a kind of list right here. You can see this list for each of them of the different parts that you're going to need to identify in lab. Let me show you a few of them on this diagram that I drew right here. So starting with the ilium, where we have the sacrum and ilium joining, we have a joint, and that is called the SI joint, or the sacroiliac joint. Right next to the sacroiliac joint is this huge fossa known as the iliac fossa. And on the very edge, we have the iliac crest. And you can even feel your iliac crest right now. If I told you to put your hands on your hips, you immediately put your hands on the hips, you're touching your iliac crest. That top, really kind of big bony part that you feel, that is your iliac crest. Now at the very edge or bottom of the iliac crest, we have what's known as the anterior superior iliac spine, which is abbreviated the ASIS. Anterior superior iliac spine. This is going to be a muscle attachment site. Below the ASIS is the AIIS, anterior inferior iliac spine. Now, I only drew the pelvis looking anterior to posterior, but if we turn the pelvis around, you would also find a posterior superior iliac spinous and a posterior inferior iliac spinous. So there's 2 on each side. From there, let's now look at some of the things we can find on the ischium. So over here, kind of in the middle, now the ischium kind of runs in the back of the pelvis. So if I was doing a posterior view, you would see a little bit more of the ischium. So in lab, when we actually have the bones and you're actually holding what the bones look like, you'll be able to kind of see where these are a little better than in my 2D diagram here. But this is where we will find the ischial tuberosity. This hole right here, this foramen, is going to be the obturator foramen, which is where the obturator nerve runs through, and a lot of the other kind of vessels of that area. And then finally, we have the pubis. In the pubis, we have our superior pubic ramus, which is right here, and our inferior pubic ramus, which is right here. The crest is what is between them. And then we have our pubic tubercle, which is right here. And the last part of the pelvis that we're going to look at is the acetabulum. The acetabulum is where the pelvis is going to connect to our femur. And that's shown right here. Another important part of lab is identifying the difference between a male and a female pelvis. A male pelvis is called an android pelvis, and a female pelvis is known as a gynecoid pelvis. There are also two other variations of pelvic structure, but they're fairly rare in comparison to gynecoid and android. The first difference between them is their pelvic inlet, or kind of the top part of the pelvis. In a male, it is heart-shaped, and in a female, it is very round. The second part is the pelvic outlet. So in a pelvic outlet, it's super narrow. You can kind of see it's more like an oval in a male, and it is round like a big circle in a gynecoid or female pelvis. Again, this is because gynecoids are able to birth children. And then the last is pelvic angle, and the pelvic angle is found right here. Here we have our pubic symphysis. And our pubic angle is the angle that we see right here. So my drawing right here, this is more of an obtuse angle, so this drawing is of most likely a female pelvis. Whereas a more acute angle would be a male pelvis or an android pelvis. Now let's look at the femur. Like I said, the femur articulates with the pelvis at the acetabulum. And the part of the femur that articulates with that is going to be the head of the femur, which is found right here. There is a little part on the head of the femur that is known as the fovea capitis. That is going to be responsible, or is going to be an articulation spot for the acetabulum ligaments to connect and kind of holds that head into the acetabulum. Below that is the neck of the femur. The femoral neck is the weakest part of the femur, and most likely when someone says they break their hip, they broke the neck of their femur. Now let's look at a couple of trochanters. So we have a greater trochanter right up here. That's going to be the attachment site for a couple of different muscles. The glute muscles, which we have 3 different glute muscles, the obturator internus, piriformis, and the gemelli muscles. We also have a lesser trochanter, and this is going to be the insertion site for our iliopsoas muscle. The space between the greater trochanter and the lesser trochanter on the anterior aspect is called the intertrochanteric line. Intertrochanteric line. So on the anterior aspect, when we're looking straight at the femur, it's called the line. But on the back, that same structure, so in between the GT and the LT, we have the intertrochanteric crest. So it's called a crest in the back and a line in the front. If we stay on the back and right below that intertrochanteric crest, we have this line called the linea aspera. On the lateral aspect of the linea aspera, we will find the gluteal tuberosity, which is where we have the gluteal muscles attached to. On the medial aspect of the linea aspera, we're going to have the attachment for the vastus medialis, the vastus lateralis, and the adductor longus. At the very bottom of our femur, we're going to have some condyles. A medial condyle and a lateral condyle. So in this example, this would be my medial, condyle, and this would be my lateral condyle. The space in between my two condyles is my intercondylar fossa. The space that you see that is right above either of the condyles are epicondyles. Epi is like kind of right above it. So this would be my lateral epicondyle, and this would be my medial epicondyle. And this blue area that you see right here is my adductor tubercle, which is where we have the attachment site of the adductor magnus, which is the really big adductor muscle. And all of those things are specified right here. So take a second if you want to write them down. Let's go on to our tibia and fibula. So the tibia is going to be the one that attaches to the femur. The fibula does not attach to the femur. The fibula is attached to the tibia. The fibula does not bear weight. That is a common question. Which bone of the body does not bear weight? The fibula is non-weight bearing. So let's start with the fibula because there's less to go over in the fibula. The fibula is this tiny little skinny tiny little skinny bone right here. This is known as the head of the fibula. And right down here, that is the lateral malleolus, which if you right now touch your ankle, if you were to touch if I told you to touch the little ball part on the outside of your ankle, you'd be touching that lateral malleolus. Now let's look at the tibia. So the tibia at the bottom is going to have the medial malleolus. If we look approximately on the tibia, we're going to find a few different structures. So the space right here in purple is the intercondylar eminence. And it's going to be between the two condyles of the tibia. We have a lateral condyle and a medial condyle. The lateral condyle is going to be what forms a superior tibiofibular joint, right? Because the fibula is right here. Both of these are going to articulate with the femur. Below our two condyles is the tibial tuberosity, which is going to connect the patellar ligament. So the patella is going to kind of lie right on top of the tibia, and the femur. Now finally, the last kind of group of bones we're looking at is the foot bones. There are 7 tarsal bones, 5 metatarsals, and 14 phalanges that make up the foot. So just like when we were looking at the hand, right at the very top, we are going to see our phalanges. We have a distal, a middle, and a proximal. Then we're going to have 5 metatarsals. We name them 1, 2, 3, 4, 5. And then we have 7 tarsal bones. So if we start with the most lateral, which is going to be towards the big toe, the greater toe, we have our lateral cuneiform. Then we have our medial cuneiform on the opposite side. And in between the lateral cuneiform and the medial cuneiform, we have the intermediate cuneiform. It's the middle child. Whoops, I misspelled that. To the cuneiforms is the cuboid. Below or proximal to the cuneiforms is the navicular. Cuboid is lateral to the cuneiforms. Navicular is proximal to the cuneiforms. Right below the navicular, we're going to find the talus. The talus is what's going to connect to the ankle. It's going to actually connect to that lateral malleolus. And then we have our heel bone, which is our calcaneus. There are 4 different arches that make up the foot. We have a medial longitudinal, a lateral longitudinal, and a transverse arch. The medial longitudinal arch is made up of the calcaneus, our heel bone, the navicular, our 3 cuneiforms, so the medial, lateral, and intermediate, and our 3 medial metatarsals. So that would be the first, second, and third metatarsals. So those I will color. Medial we'll do in green. So longitudinal, the medial longitudinal is going to be right here. The lateral longitudinal arch is going to be made out of the calcaneus, the cuboid, and the lateral 2 metatarsals. And I'll do those in pink. Right here. And then spreading between the 2, the medial longitudinal arch, is a transverse arch. The transverse arch is made up of the cuboid and the 3 cuneiforms, the medial, lateral, and intermediate. And we'll do that one in blue. It's important to know all of the bones that make up the arches. It's a common question you'll see. So those are our bones of the appendages of our appendicular skeleton. If you guys have any questions, feel free to email me or come to Open Lab on Thursdays from 5 to 8.
This video is for educational purposes only, and the information provided is not intended to diagnose, treat, cure, or prevent disease.